What's good, Hoopers? In this video, we're going to go over some of our go-to eccentric quad exercises of various difficulties that you can try on your own. If you are dealing with jumper's knee or you just want stronger, healthier tendons in general, these are some great exercises for you to build into your routine. For those that don't know me, my name is Dr. Gabe Ignacio, Doctor of Physical Therapy, Board Certified Orthopedic Clinical Specialist, and co-founder of Basketball Doctors. Like we mentioned in this video, we're going to go over some of the quad eccentric exercises, which are great to build strength in your quad in the early stages and help build tendon capacity so that you can build from early to late stage to return to sport type of deal. If you are dealing with jumper's knee and kind of are lost with your rehab, check out our online rehab program that will guide you step by step from early stages all the way to return to sport. The link is in the description below, so try and check that out if you're interested. And another thing, if you are dealing with jumper's knee, comment below and maybe where you're from and see if we can help you out that way. Alright, so for those of you that are unfamiliar with what an eccentric or negative exercise is, we're going to briefly go over it now. So there are a couple different type of contractions. We're going to go over the main ones real briefly here. So the first one is a concentric exercise. I'm just going to use a bicep curl for an example. So my right arm is going to be reference one. So if you think of a bicep curl, when you're bringing it up, your muscle is contracting, right, on the way up and on the way down. So when you bring it up, the muscle is shortening. Imagine like the bicep coming in like the Popeye arm type of thing. So when it's shortening, that's the concentric contraction or concentric part of the movement. Isometric is pretty much an isometric or a hold at a particular joint angle. So for example, when we're holding our arm here at this 90 degrees, gravity is working down against my arm, or saying if I have a weight and I'm holding it there while I'm contracting my muscle, that would be considered an isometric or a hold, and the muscle's working that way. So that's another type of contraction. Another one is isotonic. This one's a little bit more complicated. You usually need a device or something that will give you constant pressure. In newtons usually pumps out, just because if I hold a weight, when I bring it up and down, the weight's going to weigh a little bit differently because of how the gravity is interacting with it. So on the way down, down at this angle, it won't be as heavy. When it's up at here, it won't be as heavy, but in this middle ranges, it'll be a little bit heavier. So it's not as consistent, but you still can do it that way. The big thing is the velocity stays the same. So I'm going throughout the range of motion at a constant rate, both up and all the way down. So that's an isotonic contraction. And the final one, the eccentric or negative, is pretty much when the muscle is contracting while it's lengthening. So as you can imagine, when I'm holding a weight here just with my arm, my muscle is contracting while I'm slowly lengthening my arm all the way down to the starting position. The muscle is lengthening, so opposite of it shortening. When I do the concentric movement, it is lengthening. So to break it down more simply, eccentric is lengthening. It's the opposite of concentric movement. And why that's important is because when you're early on in your rehab or trying to build capacity in your tendon, this is a great way to overload the tissue because it can take more load essentially in comparison to concentric contraction. So if you imagine like trying to lift up like a 50 or 60 pound dumbbell, if you're not trained, you kind of have to use momentum, or it might be a little bit more of a challenge for you. But if you grab the weight up top with that 50, 60 pound weight and then slowly lower it down, majority of the time you can control that if you're relatively trained all the way down to starting position, versus on the way up, you're kind of cheating, compensating. On the lowering down, you can really control it. So the eccentric exercise allows you to help build strength, muscle contraction, while overloading the tendon and the muscle in comparison to the concentric movement. If you have any questions regarding those types of contractions, just ask them below. We'll get to them more. We'll adjust them a little bit differently in different exercises that we do along the way. But if you have any questions specifically about eccentric exercises, feel free to ask them below and we'll adjust them in the text box, or we'll make a bigger video if we need to. And in terms of sets and reps, it typically varies from who's programming, but typically 5 to 8 reps per set will be sufficient, and then how much volume you need will depend on where you're at with your goals. But the big and most important thing with the eccentric or negative exercises is you want to go slow and controlled. So what I mean by slow and controlled is if you're up here with that dumbbell, you want to slowly go down around that 4 to 5 second count range, and try not to just go slow in this top part, and then when you get to that middle range, go down quick. You want to make sure as the muscle's lengthening throughout the range of motion, you want to go slow and controlled all the way down so you hit the bottom of the range. If you have any questions, mention them below, but we'll get into the exercises now.
All right guys, we're gonna go over the reverse Nordic. So we're gonna be in tall kneel position here, knees on the ground, foot's plantar flexed. I'm gonna cross my arms, tuck my butt in, activate my glutes. You're gonna feel a quad working here. You're gonna go into that stretch, but then you're gonna come out of that stretch. So I'm gonna go as far out as I can without my losing position here in my back, because I'm nice and tall and engaged. Once I feel that stretch and I can't go further, then I come back using my quads there. So I'm slowly controlling that stretch, then coming back. What I don't want you to do is this is a little different. I want to keep my body nice and tall, nice and straight, and then come back from there. All right guys, we're gonna go over the forward lunge with an emphasis of having your knee going over your toes. So here in this position, we're gonna go into this lunge position, but when we land, we wanna land with our forefoot, okay? So we're land on our forefoot, then our heel comes down, and I want my knee to go past my second and third toe. So it's aligning here, go as far forward as I can, then from there, hold it there for a second, then bounce back up. So we're gonna do that once again. You're gonna feel that, a little stretch in your ankle, you're gonna feel that in the quad, the tendon, and then come back there. And I'll show you this way just to make sure, positioning wise, my knee's not going this way, that way it's going straight over my second and third toe. All right guys, we're gonna go over the decline squat, eccentric emphasis. So we're gonna place our leg here. You could use a curb, a step, anything that's gonna lift your heel off the ground approximately 25 degrees. So the higher the better, but we just don't want it to be too low. We want it to be a little bit higher. So a curb is perfect, a little stair step, anything that just lifts your heel off the ground. So in this position, I'm gonna slowly lower myself down, and I'm gonna keep my trunk upright as much as I can, because I want all the pressure to be on my patellar tendon and quad. So as I go forward, chest is upright, all the moment is coming here, my patellar tendon. I'm gonna go down to 4 seconds, then I'm gonna come back up on 2 legs and then reset. So I'm not coming up with 1 leg back to this position, it's just eccentric emphasis. And make sure your hips aren't swaying, you're not curving too much. That's gonna put less stress on the tendon. We want more stress on the tendon. So in this position again, chest is upright. I'm gonna slowly reach out as far out as I can. I want my knees to go past my toes. And then from there, lean over this leg, then come back up.
All right, welcome back. Hope you enjoyed some of those exercises. Comment below if you have done those exercises or currently doing them in your program, or every once in a while. Let us know so we have an idea of where you're at with everything. Like we mentioned, if you are dealing with jumper's knee and are a little lost, need a little bit of guidance step by step from early stage all the way to late return to sport, click the link in our description below to check out our online rehab program. Or if you want to work with us in person or online, send us an email and we'll get to you that way. Don't forget to hit that like, subscribe, share button. Help us with the YouTube algorithm of reaching more people and more hoopers. Just want to make a difference and help as many hoopers as possible. Like always, let's ball for life.